Now on to health matters. Stakeholders in the health sector have underscored the importance of public-private partnership in the successful realization of universal health coverage. The Population Services Kenya says the existing gaps in the health sector require the input of all players, including non-state actors. This, it says, will expedite deployment of qualified medical practitioners and necessary health facilities, which will boost access to qualified and affordable health services, especially in low-income populations.
Quality and affordable healthcare remains the key agenda of the government, whereas it's also a dream to millions of Kenyans. The rollout of universal healthcare was set in motion by government last year when it commissioned its piloting in 4 counties. The role of the private sector in healthcare, however, cannot be overemphasized. Speaking during celebrations to mark 10 years of Tunza Family Health Network, Population Services Kenya's CEO Joyce Wanderi drew attention to the role of the private sector in provision of health services.
We've worked with NHIF on empowerment of providers and ensuring that also clients are aware that they actually need to get into NHIF to reduce out-of-pocket expenditure. And most importantly, the Ministry of Health. We've worked very closely with the Ministry of Health on training our providers. We use the MOH-led curriculum and MOH trainers train our providers. We work with them through the mentorship of these providers, support supervision. At the same time, even as we talk about the Kenya Quality Model for Health that we've talked about, which is a new quality model for Kenya, that's one of the things we're working very closely with the Ministry of Health to make sure that all the private sector providers adopt. So
Wanderi noting that the franchise has been instrumental in screening and management of non-communicable diseases, having sourced to 500,000 Kenyans for cervical cancer. She further noted encouraging development in the area of training, whereas thousands of healthcare practitioners from private facilities have benefited from capacity building initiatives. These trainings have been spearheaded by the Ministry of Health in areas of family planning, cancer, HIV and AIDS, safe motherhood, among others. On his part, Dr. Kenneth Ireri of Ukunda Medical Center said the collaboration between Tunza and the Ministry of Health has helped private healthcare providers greatly improve service delivery, especially in rural Kenya.
Contraceptive devices were very, very difficult for us to sell. Although it is a very good method, there was a lot of opposition from even the religious background in cost. But when Tunza came on board, they gave us the counseling skills on how to counsel clients on the benefits of the method, and they also trained us on how to insert. And at the end of the day, we had very few or none side effects or problems arising after insertions, and so this helped to sell the method. When we started, I was doing about 2 intrauterine contraceptive devices insertions in a year. But after Tunza training nowadays, we do around 10, not less than 10 in a month.
Caroline Kamar reporting for Channel 1 Lunchtime News.